ABC News medical contributor and pediatrician at Stanford Children's Health, Dr. Alok Patel. Dr. Patel, thank you for being here. So much confusion out there. The CDC concluded that requiring masks for travel remains necessary for public health. What do you think about that, especially in light of the idea that these mandates were set to expire in 2 weeks anyway?
Dan, that's really what it comes down to, is what the CDC's authority is when it comes to preventing the spread, the transmission of these communicable diseases, which is why I think this ruling by the federal judge, the appeal by our Justice Department, is really going to be integral for the CDC to come in and step in and just really talk about the science and the data and why the timing actually matters. Now, whether or not the mandate is overturned, I think it's besides the question. What is important is that the CDC reminds people that masks are still an effective, important tool for protecting yourself against these aerosolized droplets, especially in an indoor setting. And that really sets the standard, Diane, for future outbreaks, pandemics, when it comes to the CDC making these recommendations and building that public trust.
Logistically, though, how do you think they navigate this now that there is all this confusion? The masks already have come off, and even in airports like JFK, our own Gio Benitez saw today people on the TSA line, even some workers without masks on. So it seems like already that genie's kind of out of the bottle. How do you put it back in?
It is out of the bottle, and I'm trying to figure out the genie out of the bottle analogy because people keep saying it, and I'm picturing scenes from Aladdin. We're just not even going to go there. What I'm thinking right now is that the CDC just needs to be very transparent about the effectiveness of masks. And like I said, even if it's not overturned, people out there deserve to know the truth about how effective an N95 or a KN94, KF94, KN95s are in protecting yourself, even if that's one-way masking. So even if the decision isn't overturned, people still know, hey, there are more than 30,000 cases, 500 deaths a day. What is acceptable for us out there? How do you keep yourself safe if you're immunocompromised, if you're under the age of 5, your child is, and can't get a vaccine? And the CDC needs to come in here with that transparency just to make sure that in the future, whenever there's a recommendation, we are following the data and not just these legal cases, which is where a lot of the confusion is coming from.
So if you want to still protect yourself and you want to put a mask on, if you get the KN95, the KF94, that can still provide protection to you, even if everybody else is unmasked.
Absolutely. And I will tell you, for years, physicians have been one-way masking in the hospital. I will wear a fitted, keyword fitted, N95 and go into a patient's room who may have an aerosolized infection such as tuberculosis. And we don't catch those infections. One-way masking does work, especially in a ventilated setting like an airplane, where you're having the refreshing of air every few minutes. You know, even a modeling study, Diane, showed that if you were not wearing anything at all and you were talking to someone who was infected and unmasked, you can get an exposure that would cause you to be infected, according to the model, in about 15 minutes. That number goes up to more than 2 hours. If both people are wearing an N95, more than an hour if you're wearing an N95. So some protection is better than nothing, and the higher the filtration, better the fit, the better.
All right, Dr. Alok Patel, it's always great to have you, Doctor. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.